Hello, good morning. If you struggle to understand different visual field defects and anatomical defects behind them, this video is for you. So we will try to explain visual field defects with real life examples and hopefully at the end of this video your understanding of visual field defects would help you with your exams as well as potentially improving your clinical skills when you're approaching the patients as well. So let's dive into this. I have divided visual field defects into three main types based on how they present. And so these three types are homonymous hemianopia, homonymous quadrantinopias, and bitemporal hemianopia. Before we begin to discuss different types of visual field defects, we need to know what is a congruous defect and what is an incongruous visual field defect. A congruous visual field defect is in which there may be a symmetrical loss of visual field, and an incongruous defect is where there may be an asymmetrical loss of visual field. So, as I've already discussed, in congruous defect there is a symmetrical loss of visual field. The defect may be in optic radiations as well as in occipital cortex. So if there is a lesion in any of these sides, you can get a congruous defect, a symmetrical loss of visual field. So keeping that in mind, congruous and incongruous, let's dive into different visual field defects, the types of different visual field defects. Yeah. So we will first discuss if there is a lesion of optic nerve. So if there is a lesion of optic nerve, it causes a total blindness or visual loss in one eye. As you can see in this picture, there is total loss of vision in one eye, and one eye is completely blind while the vision on the other side is completely normal. So that is when there is a lesion of optic nerve. Then we will discuss a lesion that affects optic chiasma. So you can see here we have a visual field defect which is called as bitemporal hemianopia. There is visual field loss on both the temporal sides of both of eyes, and you get what is called as tunnel vision. Here you can see the temporal side of lesion on both the side is lost. Then we have a lesion which affects the optic tract. So if the optic tract is affected, the visual field defect is called homonymous hemianopia. Here you can see the nasal side of one eye and the temporal side of the other eye is affected, and there is a visual field loss that is called as homonymous hemianopia. If the visual field loss is on the right side, that is, then we will have left homonymous hemianopia. And if we have the left optic tract that is affected, then we will have right homonymous hemianopia. Then we have a visual field defect of optic radiation. So there are two types of optic radiations, as we have already discussed: superior optic radiation and inferior optic radiation. Superior optic radiation passes through parietal lobe, and inferior optic radiation passes through temporal lobe. Now, if there is a lesion of superior optic radiation, we will get the visual field loss of inferior quadrantinopias. As you can see here, inferior quadrant of the visual field is lost, and we will have the lesion of parietal lobe, which will affect superior optic radiation, and we will get inferior quadrantinopias. Similarly, if there is a lesion of inferior optic radiation that passes through temporal lobe, we will have superior quadrantinopias. And in superior quadrantinopias, we will have superior quadrant visual loss of both the eyes. As you can see here, the vision loss is on the superior quadrants of visual field, and this happens when optic radiation that passes through temporal lobe, or otherwise we call as Mayer loop as well. So if there is a lesion that is affecting them, or if there is a lesion that is affecting temporal lobe, we will get this type of visual field defect. And now we will discuss visual field defects which affect, let's say, if a lesion is affecting the occipital cortex. So the visual cortex in occipital lobe, if it's affected, we get uh, a similar homonymous hemianopia, but this time there is macular sparing. The macula is spared. As you can see, there is a bit of macular sparing in this image, and this type of visual field defect would result if occipital cortex is affected, if the lesion is affecting occipital cortex. So we will have essentially this type of visual field defect, and this is called as homonymous hemianopia with macular sparing.